welcome back to Sexy Sips, Tufts Sex Health Reps podcast, where we talk about sex health, love, intimacy, and relationships. Today we have a very special episode where we're talking about pregnancy scares with some very special guests who are our sex health consultants for the CARE Office. So I'm going to introduce myself first. My name is Caro. I use they, them pronouns. I'm a senior at Tufts, and I'm also the podcast coordinator this semester for Tufts Sex Health Reps. And if you guys want to go ahead and introduce yourself, that would be great.
Hi, I'm Shayan Hashmi. I'm one of the physician assistants at Tufts University Health Services. I'm also a sex health consultant at CARE. I use he, him pronouns, and I see students at Tufts Health Services for both medical complaints and also meet with them for sex health-related conversations or issues as a CARE clinician.
I'm Lisa Keegan. I use they, them pronouns. I'm one of the nurse practitioners at Tufts Health Services and also one of the sex health consultants. I love talking to people about sexual health and pleasure. Any questions that people have or concerns that they have are fantastic reasons to make an appointment with us.
And I'm Ariel Watriss. I use any pronouns. I'm the senior nurse practitioner at Tufts University Health Services and also one of the sexual health consultants. My goal with any of the meetings that we have with folks around sexuality or any health stuff related is for folks to feel empowered and have sexual health autonomy, and we are all really excited to be here.
Yay, thank you guys so much. I'm really excited about this podcast episode. As you know, we've been making this happen for almost a whole semester now, so I'm very excited that it's finally happening. Today we're going to be talking about pregnancy scares, which is something that I know a lot of Tufts students experience, and so we're going to chat about what to do when you have a pregnancy scare, how to prevent that, and what resources are available specifically at Tufts for students when they deal with this really stressful thing that happens. So let's start with a general question. What is a pregnancy scare and why are they so common?
So pregnancy scares happen when someone is worried that they might be pregnant. Most often, I think it's when somebody's period is late or they miss a period is the main reason that people will come in for it. There's lots of other reasons that someone's period can be late, and so I do like to just remind people of that. But that's one of the reasons that that a pregnancy scare is so common is that late or missed periods are relatively common for a lot of other reasons.
And they're really scary. When those moments happen, it's understandably an intense time, and we get to talk to them about what potentially could be causing that pause or delay. A common thing we see here as a factor is stress. Stress on the body will impact a number of different responses and reactions to things, and there can be delays in periods from that very frequently, which makes sense in this high stress scenario of school.
Absolutely. It's almost like mental health has a role in physical health as well.
Almost.
I never would have guessed. Yeah, that is so true. I think a lot of my friends have experienced stuff like that where they've just missed a period because they're stressed about an exam, and then they're like, shit, I'm pregnant. And then, nope, they take the exam and one day later, their period's back.
Well, and it's super easy to hone in, right?
Mm-hmm.
On something like that and kind of not necessarily track what factors might be a role, and then, like you said, you take the exam and your body's like, okay, we're good now.
Yeah, exactly.
But then also thinking that you might be pregnant can add to the stress.
Yes,
and
isn't
so
that the best part?
Then could theoretically delay the period even a little bit longer because now you have this other thing to be stressed about. So it's really an inconvenient way that bodies are set up.
Mm-hmm.
Absolutely.
Sometimes also illness can throw things off because that is a stress for the body. Sleep changes, which we do see here a lot. Also, if there have been weight fluctuations, that can be a factor, and it's just not always obvious to see what the connection points are, and then all of a sudden this metric that you're used to having regularly is gone. That is understandably a panic moment.
Sometimes I'm sure for everyone here there's been aha moments where someone comes in with a pregnancy scare and you ask them these questions about how has your stress been? How's your sleep been? Have you been sick recently? Has there been any change in your physical or mental health? And then they kind of have an aha moment and put the pieces together. So it can definitely be helpful to talk to someone, talk to one of us or any of the clinicians to try to get a sense of the different causes. And, even if it's not ultimately a medical cause, it can help to figure out why things are a little abnormal.
Stress loves spirals and spirals love stress, and it can be very easy to have that little spiral happen in our heads by ourselves. We all have that experience, and it's, as like Shayan said, it's really helpful to just share that information with someone else.
Yeah.
So you can be like, what is actually happening?
Yeah, that makes a lot of sense. All right, I guess we'll just jump right in. The way this is going to be formatted is we have a bunch of FAQs sourced from my friends, sourced from myself, and just general questions about pregnancy scares that I'm sure you guys get all the time. So we're going to just centralize all of those questions and just have this be one big resource for anybody dealing with a pregnancy scare.
We love it.
Let's just jump right into our FAQs. How do you prevent a pregnancy scare?
Great question. So there are a lot of things to factor in here. The first one is knowing what is sort of baseline for you with your cycles and what to expect, and to get a sense of what could impact your body and your cycles. A lot of people will use contraception, different types of birth control, to either regulate their menstrual cycle or create a context like with using a barrier method like condoms, so that there isn't a concern for access to sperm during certain types of sexual activity, to lead to there actually being a reason why there could be a pregnancy scare. But it's really helpful to understand what is going on. And like we said, we just kind of listed all of these factors into what can cause delays in periods. That's a great starting point to kind of understand, okay, my period is X number of days late, what's been going on for me in the last couple weeks, kind of having a grounding moment to think about what's going on. And like Shayan said, getting help, talking to somebody. We want to help you. We want to make sure that this is not causing you more stress, like Lisa said, that will then delay things even further. When it comes to birth control, we can absolutely help with that at health services. There are also online sources for different kinds of birth control at this point. We have local options. We're very fortunate to be in a space where we have a lot of options around the campus as well. But we help people frequently with birth control. We help people frequently with birth control prescriptions. We also have access for some folks for IUDs and implants. But we want to help you not have the scares in the first place.
Yeah, that's a great point. Yeah. Is there ever a time that you cannot get pregnant during your menstrual cycle?
Excellent question. The short answer is theoretically yes, but bodies are so weird, and we just cannot predict them. And so it's really best to not rely only on timing of sex as birth control. And when I say sex in this case, I mean penis and vagina, or other kind of sex where sperm can get into the vagina. Generally, my definition of sex is much broader than that, but for this specifically pregnancy scare-focused podcast,
so important,
where I'm talking about penis and vagina, or PIV sex is often how I abbreviate it. So, longer answer to that question. A little background on the menstrual cycle. Day 1 is the first day that somebody bleeds. We have to pick some day for it to be the first day of the cycle. The cycle obviously is a cycle and continues, but just for the purpose of argument, day 1 is the first day of bleeding because we can see that, and the person who's having the cycle can see that. And then if somebody has a 28-day cycle, which is average, really cycles can vary from person to person, from month to month for the same person, and that's pretty normal. But if you have a 28-day cycle, then ovulation happens around day 14. Ovulation is when the ovary releases an egg. It switches back and forth between each ovary on each side. Sometimes people will get a little bit of pain when the ovary releases an egg. And if you have that, it can be a little bit cool to be like, oh, this month it was on the left side and the other month it was on the right side. Maybe makes it a little bit less annoying to have that pain. So around day 14, ovary releases an egg. If your cycle is shorter, then that's going to be earlier in your cycle. So if you have 24 or 26 day cycle, then ovulation might happen on day 10 or 12 after your period starts, can be even earlier. Or if your cycle is longer, if it's 30 days, 32 days, longer than that, then it can be later than day 14. And this definitely varies cycle to cycle. Even if someone's like, my period is always 28 days long, I can time it basically to the day, to the hour, it's the next cycle could still be the one where ovulation happens at a different time, because of the way that that ovulation is tied to the next period that you're going to have and not to the period that you just had. So this is one of the reasons that you don't want to rely only on timing. Also, sperm can live for 5 days in the uterus and fallopian tubes. After there's ejaculation, the sperm swim up through the cervix, into the uterus, up into the fallopian tubes, kind of waiting for the egg. And then the egg also sticks around for 24 hours after ovulation before it gets flushed out. So that means that there's this kind of 6-day margin around ovulation when pregnancy can happen. And then so for most people, for people who have 28-day cycles, the most fertile days are days 9 to 15. But because of the margin of error and because of how people's cycles vary and because we want to be safer, we use days 8 to 19 of the cycle as fertile days if your cycle is 26 to 32 days.
So many factors.
It's so much math.
So much math.
So using this as kind of a birth control method is something called the standard days method. And it works okay if you just don't have PIV sex or if you use a condom on days 8 to 19. Then about 13 people who use this method, 13 people out of 100 who use this method will get pregnant. And I'm so sorry. If you use this method consistently, 13 people out of 100 will get pregnant in the first year of using it.
Not great odds.
Exactly. So, all like hormonal birth control, all of the IUDs have much higher efficacy rates. Condoms are about the same efficacy rate as that. Like, I think condoms are about 72 to 85% effective.
A little higher in the 80s, I think. So many factors.
Depending on other factors.
Yeah. We could talk about condoms and like how to use
That's
those.
so interesting. Yeah. I didn't know that they were not nearly as effective. I thought it was pretty much like the 99% thing with the whole.
The human factor too.
Right.
Yeah.
So there's all birth controls have a perfect use, like a theoretical perfect use number, and a typical use.
Real life use number.
Yeah. And so the typical use number for condoms is lower. Mm-hmm. And then even sex during someone's period is not a sure thing in terms of like not being able to get pregnant during that time because, number one, not all bleeding is a period. People can have like weird spotting, especially if someone's period is irregular. Then it might be because they're not actually ovulating or because they're ovulating at just weird times and then also bleeding at weird times. And so bleeding that feels like a period might not actually be a period in the sense of this is what all the hormones and ovulation are doing. And because if someone's cycle is really short or if their next cycle is going to be really short but they don't know it yet, then they might ovulate within that time. So like you have sex on day 3 of your period, sperm is there for 5 days, and then on day 8 you ovulate, and then there you are. So this is not to scare people. I don't want to scare people, but I just think that there's a lot of myths around about timing and things like that. And I think it's important to know the details and important to just know that birth control is available, Plan B is available. Come talk to us about it, and we can help figure out a way that feels better than using timing.
I mean, we get a lot of questions about when ovulation happens or when people think they're ovulating. Mm-hmm. And we were talking about this before this recording to kind of, think about that. And really, there are windows. We know there are windows of time when this is going to happen. And unless you are actively peeing every day on a stick to check to see if you're ovulating, we're still working in that window math.
Specifically an ovulation predictor stick, not just like a...
You could pee on a stick if you want any day, but specifically, thank you. An important clarification.
There you have it, folks. Sex health consultants telling you to pee on any stick you find.
Don't we use the piss stick method?
100% effective.
Only sticks for maple trees, please.
Yeah.
I'm kidding. Yeah. But yeah, this is where it gets really important, and it also feeds into the stress that we hear sometimes when we're talking about this. And it's important stuff. Yeah.
Yeah, that's great. If I may transition into different types of peeing on a stick.
Beautiful segue.
Nice job.
I tried. What's the soonest that you could take a pregnancy test after having sex? I know in my friend's experience and personal experience, there's just a lot of myths about, if I take it right after having sex, like, I don't know, maybe that'll tell me, but yeah.
Yeah. Another great question. So pregnancy tests measure HCG, which stands for human chorionic gonadotropin, which is released when there is an embryo implanted into the wall of the uterus. That does not happen until about 8 to 10 days after conception. So conception is when the sperm meets the egg. They then kind of hang out together. The egg starts to actually divide as it goes down the fallopian tube, and then over the course of 8 to 10 days, it implants in the wall of the uterus. And that is one of the things that makes you then not have a period if you're pregnant, because there's a whole bunch of hormonal signaling going on. But until that has implanted, there can't be any HCG released into the body because it's still kind of its own separate thing. The egg and sperm blastocyst that is rolling down the fallopian tube.
We're going full on right now.
So the earliest that any pregnancy test could possibly tell you anything is 8 to 10 days after conception. And even then, for those first 8 days afterwards, maybe a blood pregnancy test would be positive because those are more sensitive than the urine ones, which means they pick up a lower level of HCG. Mm-hmm. Urine tests, the ones that you get over the counter and the ones that you get at the doctor's office, the ones that are in the sex health vending machine, those are all equally good. So getting a urine test at health services is not inherently better than getting one over the counter. If you are worried that you're going to do it wrong, then that is a great reason to come into health services and have us do it. But it's not like a better test. So with the over-the-counter ones, the urine tests, really the first day that you can rely on them at all is the first day of when you thought your period was going to come. Mm-hmm. And even then, it can be falsely negative just depending on what is going on, because that level might still be low. Anytime you get a positive pregnancy test, urine, whatever, the vast majority of the time that does mean that you are pregnant, putting aside some really edge case medical things that can happen. So you can trust a positive pregnancy test. You can't really trust a negative pregnancy test until it's been about a week after your missed period. So I encourage people, definitely take that pregnancy test, because if it's positive, then we will know and we have more time to have people make decisions about whatever they need to do. But if you are still worried that you might be pregnant and you still don't have your period, then take another one.
Yeah. Lisa, a follow-up question. What about for folks who don't get regular periods?
Yeah. Great question.
Is there a good rule of thumb for pregnancy testing timing?
I was just talking about this with someone actually the other day who has an IUD, mm-hmm. doesnment get periods.
Or PCOS,
or so any reason. Yeah. And basically at that point you are, for someone with PCOS, if they do get PCOS, polycystic ovary syndrome, means that people get irregular periods, often very few periods. They'll often skip periods. So if you do get a period at any point during your pregnancy scare time, then still take a pregnancy test, but that does give us a little bit of an indication, like something to kind of anchor on. If you have an IUD, some people who are really concerned will just take a pregnancy test every month or so.
Yeah.
If they are worried, if someone's having symptoms of pregnancy, like unusual fatigue, breast tenderness, nausea, vomiting, then I would recommend taking a pregnancy test. But if you are having those symptoms, and if you were pregnant, then the pregnancy would be advanced enough that I would expect the test to be positive. Mm-hmm. So you can, if you just take a test, if you have those symptoms, you can be pretty assured that if it is negative, then you're like, okay, I'm not pregnant, because it would be positive if I were pregnant.
Another context, too, that we see sometimes are folks who are taking testosterone, and that will stop bleeding, but it won't stop ovulation.
Necessarily,
right. Some cases maybe, but not across the board. And that is a conversation that we have sort of around, we can't use this metric of bleeding anymore to confirm that you are not pregnant if there is a context for a PIV happening in your life, and talking about ways to prevent pregnancy. But if there is something that happens and they're on T and we need to assess for that, we won't be using bleeding as a measure for that. We'll be doing testing and a conversation.
Follow-up to the follow-up to the follow-up. What if you're not having any symptoms, but you just have this, it's 3 weeks after you've had PIV sex, and you're having no symptoms, but you're just I think I might be pregnant. You're just anxious about it. is there like a timing on that if you have no symptoms whatsoever?
Great question. Yep. So I would say like soonest is 2 weeks after. A little safer to wait that 3 weeks because of the timing of like when conception could have happened and the implantation and everything. So if someone's in a situation where they had sex like one time or like that was the last time they had sex and you have that window, then you can take a test and be pretty confident. Great question.
And we're all about follow-up appointments too. Like, we'll if someone comes in with that scenario, and we're like, it's a little too early, but let's make a plan for what happens if nothing happens in the next X number of days. We're all about supportive math in that respect.
Or it could be just like if you feel more comfortable getting a pregnancy test and taking it at home and then just like being chill, we'll just talk about the timing to do that.
Absolutely.
Yeah, that's great. What about Plan B? When can you take Plan B?
This is a great question, and one that's a little bit more nuanced. So ideally, you should take Plan B as soon as possible after unprotected sex, but there are different types of emergency contraception. Plan B is just one type. Plan B is also called levonorgestrel, and that's the most common type of emergency contraception that everyone really knows about. They're just, I think they're just really good at marketing and branding, and they're just approved. And that is most effective if you take it within 72 hours of unprotected sex. It works by delaying ovulation so that egg can't meet the sperm to prevent pregnancy. It can technically still be offered within 5 days after unprotected sex, but it's less effective. It's much less effective than those first 72 hours. So that is, generic Plan B levonorgestrel. 72 hours is the rule of thumb for that. There is a different type of emergency contraception called Ulipristal is the generic name, and the brand name is Ella. Ella is just easier to say, so I'm just going to say Ella. And that one is effective for 5 days after unprotected sex, so that may be a good option if you're kind of in between that 72-hour to 5-day window. And then there is actually still another option as well. Believe it or not a pill, but like a copper IUD can be used for emergency contraception too. And that can be used within 5 days as well. There are some different considerations deciding like what kind of emergency contraception makes sense for you. Obviously access is a big one, what you have access to, timing. So, within 72 hours, Plan B will work just fine. After 72 hours, but less than 5 days, Ella or a copper IUD. For those who live in a larger body, Ella may be more effective. Some studies show that folks who are greater than 165 pounds, regular Plan B or levonorgestrel is not as effective. Ella is effective for folks up to 195 pounds. And then actually a copper IUD is effective for people at any weight. So that can be like kind of a great overall option. But of course, requires a little bit more work to have a copper IUD placed.
And then you have birth control on board, which is pretty great.
Right, yeah. So you continue to prevent pregnancy with a copper IUD, so it just keeps on working. So
you can also use one of the hormonal IUDs, Mirena, for emergency contraception. That was more recently approved.
Yeah.
But that is also, similar considerations to the copper IUD, but just good to know that Mirena is also an option for emergency contraception, same within 5 days.
Yeah, I was looking at studies about that. It seems like it was phrased as like no less effective as a copper IUD. I did read that like the American College of Obstetricians and Gynecologists haven't for some reason yet fully approved Mirena as emergency contraception yet. But I think that they're just looking for kind of more data. And certainly it's a good option if, that's one of the options that you have. But yeah, the one that they approve is the copper IUD. But that will probably change soon.
One thing that some of my friends have done before is that if they are over 165 pounds, they'll just pop 2 Plan Bs. Is that something that works? Is that something that is recommended?
Well, That's a good question. It's difficult because, no one is studying taking 2 Plan Bs at the same time. On paper, I suppose it probably makes sense, but in practice, it's hard for us to give any solid recommendation that would work versus not work. If you were to do something like that, then I would just say be very careful and still pregnancy test frequently and regularly just to give yourself peace of mind and confirm. But it's hard to say. There's just not really data in one direction or the other. Would you both agree?
Yeah.
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 And I also just want to point out that it's really frustrating that we do not have data for people in larger bodies, and it is absolutely because of the fat phobia of the medical establishment in general.
Mm-hmm.
Yep.
Mm-hmm.
It sucks.
Yeah. Okay, I'll have to let my friends know that maybe just taking 2 Plan B isn't the best course of option or best course of action.
Well, Ella is then a good option,
Yeah,
which is
Ella
prescription
a good option.
only.
Yeah.
And Ella is a pill?
Yeah.
Yeah.
Ella is a pill, yeah.
Yep.
Yeah.
Gotcha. Where can you get Plan B specifically, seeing as that is the most common?
Yeah, so there are different places you can get Plan B. You can get Plan B on campus at the Sex Health vending machine. I think it's in the campus center lower level, and I believe it's about $9, which is pretty cheap as far as those things go. You can receive Plan B at health services as well. We really dispense generic Plan B levonorgestrel, but we can write prescriptions for Ella if that's kind of what's needed based on timing or size. And then also, you can, in all 50 states, even in today's America, in all 50 states, you can buy Plan B over the counter at any retail pharmacy. It is protected. It's pregnancy prevention, not in abortion. And so it's still perfectly legal. You can get it at CVS or Walgreens. It will probably be a little bit more expensive than getting it from the Sex Health vending machine. It certainly will be, but it's an option. You could also purchase it online. Like even Amazon has generic versions of Plan B that are available. You'd probably have to pay for next day shipping because timing is of the essence. But you do what you got to do.
Use that Prime membership for
Exactly.
good.
Yes, use the Prime membership for good. But yeah, it's out there. It's definitely available. When in doubt, you can come and see us at health services. We can help, especially if cost may be a factor or if you're just not sure, which form you need.
I'm curious if either of you have written a prescription for Ella recently. It's been a long time for me, and I can't remember how much it costs.
I also
it's
can't
been a
remember.
while. In fact, we, for a while, carried it at health services as, a medication we could dispense, but we found that we were dispensing it so infrequently that it would just expire. We'd have to throw it away. We'd have to buy more. And so now we just prescribe it if people need it. But yeah, it's been a while.
It's been a while, yeah.
And it'll depend on insurance because at that point, because it's prescription, it'll be a copay.
It's a copay.
So that just varies so widely with people's insurances
Yeah.
and what's going on. So we can't really predict it, unfortunately.
Yeah.
Is Plan B free at health services, or do you have to also pay $9 for it?
You have to also pay. It goes on the bursar bill. Just as a health
service
services fee, so
yeah.
it's anonymous. It just says
Yeah.
that if somebody's parent or guardian or person who pays their bills were to see it, then you could say, oh yeah, I had to go to health services. I guess they charged me a weird amount of money for something like I had a cold. We're a big fan of lying to your parents if you
Big
need
fan.
to.
Yeah.
Yeah, that's a really good point. What happens if it's been 3 days or 5 days and it's too late to take these emergency contraception options?
Don't panic. Take a pregnancy test. I think Lisa talked in depth about timing for pregnancy testing, and give it time. If your pregnancy test returns as positive, or if you're not sure about pregnancy testing, you can certainly come into health services and we can talk to you about different options. I promise it is not the end of the world, even if it may feel like the worst thing ever. That's exactly what we're here for. So, not all folks who have unprotected sex and miss the window for emergency contraception get pregnant. Give yourself some time and take pregnancy tests to see. But, if the test is positive or when in doubt, come see us and we can work together and go from there.
Yeah, that's great. I'm going to skip a question for Ariel and then come back to it. what happens if you can't afford a pregnancy test, Plan B, or Tufts Health Services because your insurance doesn't cover anything, or for whatever reason you can't afford those resources?
Great question. So visiting health services is always free if you have paid the health and wellness fee. All undergraduates have to pay the health and wellness fee, and the vast majority of grad students on the Medford campus also have to pay the fee. So coming into health services...
And that's regardless of your insurance.
Yeah,
to be clear.
yeah. If you have the student insurance, if you have outside insurance,
Yeah.
if you have no insurance, like whatever the situation is, the visit is free. So definitely come in and we can talk. Pregnancy tests at the Sex Health vending machine are $7.44, and Plan B is $9, like Shayan said, which I realize can still be unaffordable for people, but I do think that there are lots of people who that will really help. Like that, it's cheaper, much cheaper there than at CVS, for instance. If somebody does come to health services for care after they've experienced a sexual assault or non-consensual sex of some kind, then pregnancy and STI testing is free. We waive all of the fees for that, regardless of insurance. If somebody does need pregnancy test Plan B, like really can't afford that in any way, or if they need an abortion and can't afford that, abortion at health services is free. We can do medication abortions. That means abortions with pills, which not everybody, it's not safe for everybody to do an abortion that way. Sometimes people need a different kind of procedure, but always just come and talk to us so that we can figure out if that's an option for you. And then regardless of what happened, regardless of what the circumstances were, abortion is free at health services.
To everybody.
To everybody, regardless of
Grad
insurance.
students, undergrad, everybody.
Everybody.
Yeah.
And Planned Parenthood offers low-cost sliding scale options as well for somebody if they can't use their insurance because it's through their parents and they're worried about anonymity. Then just call Planned Parenthood, basically, and tell them the situation. They work with people for this all the time.
Mm-hmm.
If somebody does need to have a procedure abortion, there are abortion funds as well that can help. But yeah, I would say the upshot is just come to health services because that visit is free, and then we can figure out what individually works for that person depending on their circumstances.
And just to add to that, we have in-person visits. You can also set up a phone call, and we also have telehealth over Zoom. So if for whatever reason it's hard to physically come in, we are accessible through a number of different ways. And I'm thinking about times that I've had conversations with people first over Zoom, sometimes with their camera off because they just can't deal, and that's okay. I don't need to see your face. It's always wonderful to see your face, but we don't have to see your face. We can also start as a phone call. I have had people have friends try to come in and get information for them. There's only so much we can share respecting your confidentiality as a patient. We want to give your friends information, but we can't do your appointment with them. We have to kind of see you at some point or talk to you directly. Just naming that this can be an intense thing to talk about. But we really, if it wasn't already clear, really want to help you with this if you're having a panic moment.
Yeah, that's great. And just to segue into medical abortions, what's the deal with that? How does this work?
What is the deal with that? The deal is that we've been doing them for just over a year. We started last September 2024. And the deal is that if somebody thinks that they need help figuring out if they're able to do a medical abortion, like Lisa said, there are circumstances where it may not be the right timing or not safe for someone to do a medical abortion, which is using the pills for abortion. We want people to come and set up an appointment with us, and we will talk it through. There is no cost for the pills for this service. If you've paid the health fee, you can come and see us, and then we literally just give you the pills. We do need to do some testing. So Lisa mentioned the HCG levels that can go up at the beginning of the pregnancy. We use those levels to track how successful the medical abortion was after the pills have been taken. And so sometimes we do 2, sometimes 3 different tests of this at the clinic. We usually use insurance. If that is an issue for somebody, that's part of the many conversations we have at the beginning of the process. And we talk about the out-of-pocket cost for that if we need to do that. We talk about other ways that we could potentially do those labs. But like Lisa already said, please blame us. You can say that, they did labs at health services and you didn't know what they were for. Or, if you have to give a little bit of information, I was having a period issue. It was just part of their workup. I don't know what they ordered. Please blame us. We're here to protect you and take care of you. Parents can learn and figure things out later. They're not our job. You are our job. And
Well said.
I don't, as I'm saying this also as a parent, I want my future teenagers to know that if they need the care, I don't have to know everything, right? And it's important that they be able to trust who they're working with. But it's really kind of straightforward. Like, there are a number of people who can help with this in the clinic, and appointments are set up. We have fabulous lists of questions that we run through to kind of make sure that we're not missing anything. We educate, we give many resources for folks who are navigating the process of the abortion itself. We have fabulous care packages with heat packs, tea, ibuprofen, comfy socks. I'm trying to think what else is in there. Just really comfortable things just to kind of help, because it can be physically uncomfortable. It can be a lot of cramping, it can be a lot of bleeding, and we want people to have support around that. And we really want to help with it.
That's so great. I wish all college campuses had this. I remember talking to a friend of mine who goes to school in Florida, and she was dealing with something like this, and I just mentioned that Tufts offers these medicated abortions, and she her mind was blown. And so it's really great that Tufts has these resources. So let's pretend that there's a student and they're pregnant, and maybe they are going to get an abortion, maybe they're not, but they're dealing with a lot of mental and physical challenges as a result of this pregnancy. What does that student do about their academics and their social life?
Very important question. One of the things that we cover a lot in the visits, regardless of what the decision is around the abortion, if it's going to happen or not, just reviewing the options, we want to talk about and check in on who their supports are, what's going on academically, how are they doing around life beyond what this situation is that they're dealing with. And what we can do, and offered this as a part of the conversation, is without giving any information about what's going on, we can let advising deans know that there's something going on medically and this person needs help for the next fill in the blank number of days. I usually say like 7 to 10 days if I'm helping somebody with this process. When it comes to social context, we of course want to make sure that they're safe and that they have a safe space to kind of navigate the next few days if they need to. Who are the people in their life that they can talk to about this and that can support them through this? Do they need connection with the counseling center? Do they have someone off campus? Do they want to connect with somebody on campus? Would it be helpful to have a conversation with somebody from the chaplaincy? Is there a spiritual or religious component to this that they need to have conversations with somebody about? We have the care team that can also be a great resource for folks that are navigating this. And we're also doing pretty steady follow-up with them through the next few days. But it's really a very subjective conversation because it really depends on what people's needs are. But we do kind of get a baseline about what are they navigating, what do they need help with, and kind of figure out the resources from that point.
I also want to shout out that Res Life can help.
Oh, yes.
If somebody is having a medication abortion, then there will be bleeding and cramping, and they may need to just be able to access a bathroom more frequently. And so there are respite suites or respite rooms where there's a bathroom attached, so somebody could have a private bathroom and just go there for a couple days if they need to. So if that's a thing that you need, we talk about that in the visit as well.
Oh, that's so great. Good job, Tufts. All right, and our last official question is, what happens if you've had an abortion and you're worried about legality? You're worried about, maybe I'm not from Massachusetts, maybe I'm from a more, we'll call it conservative state, and I'm not sure that abortion is legal in my home state. What do I do? What legal protections do I have inside and outside of Massachusetts?
That's a really good question, a very valid question, unfortunately, with society today. I will preface by saying that none of us are lawyers, of course, but there are lots of legal protections in Massachusetts. There is an abortion legal hotline that we'll put in the comments that can help answer particular legal questions, both regarding folks who are inside Massachusetts and folks who plan to leave Massachusetts. There's also a website associated with that as well. We'll give the link to that too. And Massachusetts itself has a shield law that protects patients and the medical providers who provide any legally protected healthcare service that is performed in Massachusetts, and that includes abortions from any out-of-state legal actions. So even if, an abortion may be illegal in X state, as long as it's performed in Massachusetts where it is legal, then Massachusetts will not allow outside states to prosecute within their jurisdiction. Massachusetts did have some updates to their SHIELD law as well to strengthen the protections. And so this update to the SHIELD law actually prohibits state and local authorities from cooperating with federal out-of-state investigations into abortions. And it restricts even more so sensitive data, including provider identities, the folks who perform medical abortions. And the governor of Massachusetts is actually prohibited from extraditing someone back to their home state to be prosecuted due to a medical abortion. However, I will say, unfortunately, this is all still very, very complex. There's, a large web of legalities and difficult circumstances. And so it is possible that if traveling to another state, then that state may try to prosecute, but Massachusetts will not cooperate with any investigation. They will not hand over any evidence. They will offer protection as best as they can. But yes, unfortunately, the most protection is within Massachusetts itself.
And I will add to that as part of the conversation when we're helping somebody through this process, we do talk about, is there any upcoming travel? Is there anything that we need to kind of think about for you, both from a medical standpoint, but also to everything that Shayan just said, just thinking about, would there be any reason that it would be unsafe for you where you're going if there was a complication from this process? But Massachusetts is I like this part of Massachusetts a lot.
It's a haven.
I do have something to add just about if somebody, had a medication abortion in Massachusetts, but then needed to travel while they were still having some bleeding, in the next week or so. If that person, the bleeding and cramping that happen after a medication abortion are identical to the bleeding and cramping that happen after a miscarriage. So when a pregnancy just ends on its own. And so if somebody did need to seek care in another state after they have had a medication abortion, they can either say that they don't know what's happening, they just started bleeding, or they can say that they, recently found out they were pregnant, but then they just started bleeding. And there's no way that a medical provider would know that anything else had happened.
Right. There's no residual evidence of the pills, of the medical abortion.
As with one detail about that is that one of the pills that you take, you can either put it in your cheeks or put it under your tongue or put the pills in the vagina. Mm-hmm. If someone chooses to put the pills in the vagina, then there may be some remnants of those. So if they had a pelvic exam later, so what I say during counseling is if you think that you're going to need to travel somewhere where this is illegal, if you are concerned about any consequences, then use the pills in your mouth rather than in the vagina. But if the pills are in the mouth, those are going to be completely dissolved. No one's going to see anything. And so there's just no way to tell. Yeah. So that is absolutely the thing. And it doesn't change the medical care that you need either. Normally I say don't lie to your medical providers because we need the information. But in this case, it's identical. It's identical.
Yeah. Yeah.
Hopefully nobody needs that information, but I want you to have it if you do.
Yeah.
Yeah.
Yeah, that's really important. Thank you so much for sharing that. Those were all of the questions that I had for you. But to finish off, I just want to ask if you guys have any information that you feel like you haven't shared yet that you would like to, and or if you have any advice for someone who is freaking out because they think they might be pregnant.
I think my advice is this happens to way more people than you think. It is not because you messed up. It is not because you did anything wrong. This is just a thing that happens to many, many people who get periods, and Health Services is here for you, and we want you to come in and we want to answer your questions. It does not matter if you think that it's silly. It doesn't matter if you are going into a shame spiral about it. Come in and talk to us. We want to help.
Yeah, I would add to that, everything you feel about what you're navigating is valid.
Yeah.
And you are, we can say don't panic, but you're probably going to panic, and that's okay. I just ask that you don't make any decisions in the panic spiral itself, and just reach out to somebody that you trust and come and see us if you can, or call us if you need to, and to, reiterate what Lisa said, this is not a moral judgment. And I feel when this happens, you haven't failed as a human. And, even just talking about the windows of time of the days with the cycle and the ovulation and how long the cycles are. One of the biggest takeaways I really want people to have is to understand that there's only so much we can control in our bodies. And they are organic, messy, weird experiences of organisms. And sometimes things happen that we could not predict. And that's what we're here for. And we want to help you with that oh shit moment. Because it's a valid emotion, but don't let it run the next decision point. We want to help you with that next point because it can be really scary. And ultimately, we want you to feel safe in your body with whatever the decision is that you make next.
Perfect.
I don't think I can top that.
All right. Well, thank you guys so much for being on the podcast. I really appreciate it.
Thank you for having us.
Of
This
course.
was so much
This was
fun.
so much fun. Can we just stay here all day?
Oh, of course. And you know what? Maybe you'll be back next semester. I have some plans.
Great.
Yes.
We're here for it.
But yeah, thank you so much for coming. Where can people find you?
We are at 124 Professors Row on the Medford campus. We also, all three of us, have contact points and bios on the CARE website. The Tufts Health and Wellness page is also an option. I think the first two are a little bit more easily accessible. Yeah.
You guys are very responsive to emails, I'll tell you that. Which I
We
appreciate.
try. Depends on how the semester's going.
It truly depends on the time of the semester.
Yes. Yeah, and email us, I guess.
Perfect. All right. Well, to finish off, this has been Sexy Sips, Tufts Sex Health Reps podcast. And you can find us at Instagram at Tufts SHR. And of course, we are also on the CARE website. And yeah, stay safe and stay sexy.